Iboan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. And a warm welcome to all our viewers joining in across the globe via YouTube as well. Usually on Healthline, what we do is we talk about a disease or a common condition faced by the general public. But today we are going to be talking about a condition, a physiological state that is experienced by majority of our females, and it's a very important period in any female's life. We are going to be talking about normal pregnancy today, and to discuss about this topic in depth, we have invited Dr. Indunil Piyadigama. He is a consultant obstetrician and a gynecologist. A very good evening to you, sir, and welcome back to the Healthline Studios.
Good evening. Thank you very much for inviting me back. And I think it's a very important thing to talk about. Now, we always talk about disease conditions and we never talk about normal pregnancy.
Definitely, sir, because it's a very precious period in any female's life, and it would be beneficial for almost all females in reproductive age to listen to this conversation. So, before we move into pregnancy, sir, my first question to you: if a couple is planning to get pregnant, before actually getting pregnant, what are the things that they should consider and how should they prepare for it?
Okay. So, that is, I think, the most important thing, isn't it? If you are planning for a pregnancy, how you get ready for it. So, basically, what we need is a sperm and an egg, and they need to get together to make a healthy baby. The egg is inside the woman's body, so that is in the ovary. So it's released into the woman's tummy, and then it's picked up by what we call a tube, and then the egg is transported through the tube into the womb. The sperm is deposited onto the cervix, and then it goes up. So basically, it's deposited in the vagina, and it swims through and meets the egg somewhere in the middle of the tube, and that's where the two of them meet and then make the two-cell stage, what we call the earliest stage of life. And then this comes back and gets into the womb itself. If you really think about this, now what is most important is for this the combination to occur properly. So for that, the sperm has to be healthy. On the other hand, egg has to be healthy.
Yes.
So if you take for a woman, when they are born with all the eggs.
They have a certain number of eggs.
Yes. And that is there throughout their life, and gradually it goes off over time. Every month they produce one egg, and that's how the eggs go off, the number of eggs will go off. So it's very important that you have a healthy lifestyle for a fairly good number of years, or a fairly good number of months, for your body environment to be perfect for a healthy baby. So what I mean by it is, one thing, to have good diet, exercise. What does that mean? So basically you maintain a normal for you, the body, the weight. Then on the other hand, avoiding all toxic material like alcohol, smoking. This is important for both the parties, because the sperm is also a very dynamic thing. That's why it's situated outside the body. Yes. Because to avoid most of the toxins or most of the exposure. So basically avoiding alcohol, smoking is very important. Then a lot of the couples and almost everyone, we advise them to be on preconceptional folic acid. This is for the woman mainly. So that will help in having a good baby at the end of the day. Then other than for these general things, we also talk about having vaccination to avoid problems occurring during the pregnancy. So rubella is one of such important thing where you need to get vaccinated at least 3 to 6 months prior to the pregnancy. Then the other thing nowadays that is coming up is the COVID. So basically, if you're planning to get pregnant, it's better for you to have the vaccination and complete it, so that you're sort of immune by the time you come for a pregnancy, isn't it?
So if you're planning to get pregnant, following all those advices would be very valuable for you, so that you create a proper environment to welcome a new life into this world. But even if you go for an unplanned pregnancy, still, of course, there are ways and means to protect you, but of course, a planned pregnancy would always be better. Now, moving on to actually getting pregnant, sir, how do you really confirm a pregnancy? A common problem most of our young females have these days, and what sort of changes would they initially experience when they get pregnant?
So basically, in the traditional way, you confirm the pregnancy with a urine test, which is a freely available test kit which you can take it from the pharmacy, and it's a very simple procedure where you can look for 2 lines on the strip. So that detects one of the body's hormones that is increased when you are pregnant. Generally, this hormone comes up within about a couple of weeks. So it's very accurate to detect a pregnancy very early. So other than for this, some of the so if you are planning to get pregnant, and then if you are doing all these things as we talk about, then once the period is missed, then you'll be anxious and you'll do the pregnancy test. So before any pregnancy signs and symptoms, this may be the first thing that you will detect. But some of the couples, it may be that they were not really expecting the pregnancy, and they the lady starts to develop certain symptoms that needs that is suggestive of pregnancy. So some of the things are the appetite change. You have a loss of appetite, then feeling of nausea and vomiting. Then the next thing is, some people, they have a change in their taste or the smell, or unduly tiredness. So those can be the minor sort of things that may show that you may be pregnant in the early weeks of pregnancy.
Now, is this urine test that they do, that they get over the counter from the pharmacy, is it confirmatory, or do they need to reconfirm it by doing a blood test, or is that good enough to say that, okay, this lady is pregnant?
So that's a very important question, I think. So when a urine test shows that there's 2 lines, that means you're likely to be pregnant. But the next important thing is, it's important to meet a doctor at this stage and to find out actually what sort of what is this pregnancy. Although we always talk about, now we are talking about normal pregnancy in this program, but there are certain variations or certain abnormal conditions that can come up at the same way. So you may not be able to detect with just a urine test. So doing an ultrasound scan to find out actually whether there's a pregnancy, or whether it's situated within the uterine womb, or is whether it's outside the womb, or is it like a normal sort of a growth of a baby or an abnormal type. These kind of things we may be able to detect by doing a scan. So it's very important, once you detect that you're pregnant, you meet a professional and get a ultrasound scan done to confirm it.
So when we talk about this pregnancy and the normal pregnancy per se, we hear about this term called the booking visit. I think that is very important in planning the pregnancy, how to move forward. So if you can elaborate what this booking visit is, and what would an obstetrician do when the female comes in who's pregnant and detected for the first time, if you can elaborate on that, sir.
I think in an obstetrician's point of view, the most important visit is the booking visit. That's where we will take a detailed history from the couple, especially from the woman, to find out whether she has any pre-existing conditions or pre-existing illness that can alter the course of the pregnancy. Then at the same time, at this visit, we do physical examination. For an instance, I'll we might check for the thyroid, whether the thyroid gland is properly, whether it looks normal, whether it's functioning well. Then we would listen to the heart to see how whether there are any abnormal sounds there. So basically we will do a physical examination also at that point. So that is one of the most important screening or I would say the steps in screening, so that we would detect any of the problems either pre-existing or that can cause problems during the pregnancy. Also, other than for this history, or that is from the patient what we ask, or the examination, we will also do a certain set of investigations during a booking visit. These investigations include looking at your general health, like a full blood count to look for the hemoglobin levels. The other things like whether there's any pre-existing infections, either a sexually transmitted infection or a urinary tract infection that can alter the course of the pregnancy. So we look for this. Then also we would be looking for the mother's blood group. Other than for that, also the mother's blood sugar levels. So those are important for us to move forward from there. So as you said, the booking visit for us as obstetrician is one of the most important landmarks, where by collecting all this information, we would be able to give a realistic or a approximate plan as to how the pregnancy needs to be followed up. That means how frequently the woman should come to see a doctor and what sort of additional tests that they need to be done. So this is one of the most important steps.
Definitely. When you're getting ready to welcome a new life into this world, to plan it properly would be the best way to move forward, because as soon as you know you're pregnant, go to a properly qualified obstetrician, and then he or she will advise you on what needs to be done, what are the based on your investigations, examinations, what kind of problem we may anticipate, what kind of remedial action we can take preemptively to avoid those problems. All these will be discussed when you meet your doctor. So now, sir, for a lay person, the duration of pregnancy, we say it's 9 months.
Yes.
And medically we estimate it for it to be about 40 weeks. But when a person comes to you when they know they're first pregnant, and we need to estimate how far along the pregnancy she is. So we do what we call a dating scan.
Yes.
And for a lay person, it might not be very well understood what we do in that. So if you can elaborate what this dating scan is and what you look for in this, and then how you would decide when they would probably deliver.
Yeah. So talking about the dating for a pregnancy, it's utmost important that we exactly know how old the baby is. So that means we know exactly how many months, or like what is the time that we are going to keep the baby in, because we can sort of calculate from the start up to now the age of the baby. So that is what is done in the dating scan. So initially what we expect is, although depending on the genetic variations, babies will grow in different sizes, but early stage we estimate that all babies grow at a certain phase, certain speed. So therefore we try to do this scan somewhere from a woman's 11 to 14 weeks of absence of period. So between this period, by the size of the baby, then we decide what is the actual age of this baby, and depending on this actual age, then we can calculate when the baby is going to be delivered. So that is what the dating scan is. So ideally speaking, dating scan, we do it somewhere between 11 to 14 weeks. The reason behind this is, when we are doing the dating scan, there are additional information that we can get from the dating scan if we do within this window. That is, especially we can look for the back of the baby's head to look for any abnormalities, like early stage onset, any what we say chromosomal problems or heart problems. Then we can look for the heart at the early stage. Look for things like the nasal bone. So those are minor things that we can look for if we do it within this period of time.
Right. And talking about the duration of pregnancy, when I said 9 months, it's basically divided into 3 parts called first, second and third trimester. Now, talking about the first trimester, when they get to know they're pregnant, when they're going through all these physical changes, they do the booking visit, maybe the dating scan might be done in the first trimester. So, when you're going through all that, it may be easily missed, certain things that certain drugs or medication that they should avoid, certain food that they should avoid. What is your advice on that when they get to know they're pregnant? What are the things that they should abstain from, and what are the things that they should try to develop in their lifestyle?
So, from a obstetrician's perspective, when a woman is pregnant, there are a lot of changes that occur within their body. So, if I say it in a lay person's perspective, because Sri Lanka is always fond of cricket, so it's like playing a test match. So basically, for a period of 9 months, you have to continue on supplying. Your body needs to supply for another person, and at the same time, you need to have that mental capacity, temperament, and to bear with all the minor problems that will occur, and also the uncertainties that can come up over time. So that is the basically most important message that we think, or the most important thing that we think when we see a woman who is pregnant at the early stage. So what we advise is basically they need to keep fit as possible. So either you do a light exercise, something like walking or even swimming or things like that. Those are important, and like being pregnant, being on the bed or not doing anything is not what we advise. Okay. Then the other thing, normal healthy diet. Take whatever the amount that you can take, and try to take good nutritious food during this period. There's no strict cutoff saying if you're 50 kilos at the beginning, you should achieve 70 kilos by the end of the pregnancy. There's nothing like that. We are not worried about anybody's weight gain or whether they are losing weight. We are not monitoring the baby's growth by looking at the mother. So basically, whatever the amount that they can take in, or whatever the good things that they can take in, we ask them to take as normal as possible. Then the other thing, as I said, it's very important, the mental health. So once you have become pregnant, it's very easy for us, anybody from outside, to say this, but there are a lot of uncertainties that might come up. You never know what's going to happen, like how the delivery is going to happen, whether you'll have an emergency operation to deliver the baby. You never know all this, or whether the baby will be all fine or whether grow fine. So those things are very big uncertainties. But being a mother, being uncertain about these things does not really help the course of the pregnancy. So what I would say, most of the people who are coming in, let the obstetrician decide on the problems. Let him be the one who is on the receiving end. You enjoy your pregnancy, and let him think about what's going to happen next and plan on that. So that is the other important message that we want to give somebody who is trying to go through the pregnancy. Out of this, the third one, I would also like to emphasize. Now, a lot of people think cesarean section is a better way of having a baby. But what a medical person's perspective, and anybody who has had a normal delivery would know, that vaginal delivery would be a much better way of having the baby. But for somebody to have a vaginal delivery at the end of the day, it is very important that they develop their mindset about it, and they develop their physical abilities or the capabilities over the course of the pregnancy. You can't just decide at the end of the day, by 40 weeks, that you want to have a normal delivery, and all this time you were thinking that you wanted to have a cesarean section. So it might not work out that way.
So you actually mentioned the next question that I was going to ask you about the mode of delivery. Now, when we talk about normal delivery versus cesarean section, cesarean section seems to be more popular these days. The females seem to be opting to go for cesarean section more. So, as an obstetrician, when you weigh the pros and cons, of course, in certain cases, cesarean section might be indicated. But
Yes, exactly.
if a person has the choice, what would be the pros and cons when you decide about the mode of delivery?
So, if you really think about why people go for C-sections rather than the vaginal delivery, one thing is a lot of women are worried about pain and they think vaginal delivery they will be in much more pain. So the second thing, some are worried about what will happen to their the external organs, or like, because there's going to be sometimes cuts, and whether it will come back to normal, whether they'll be able to have a normal lifestyle afterwards. Or it may be some people are they don't want to wait for uncertainties and they want to decide for themselves, this is the time I want this to be done. So the easiest way for me to go ahead is with a cesarean section. On the other hand, there is a problem with the medical profession also, because in a way I would say it is much easier for us to arrange a cesarean section rather than waiting for a vaginal delivery as a obstetrician. So all these things together favors towards the cesarean section in a lot of people's mindset. But if you really take about the pros and cons, now a baby is basically in a watery environment within the mother's tummy. So basically baby is breathing in and out the water that is around the baby. But when the baby comes out, the baby needs to be able to breathe in air. So completely change from water to the air. So what happens in a vaginal delivery is the baby is squeezed through the birth canal so that all these secretions and the water in the lungs are drained out. On the other hand, when the baby comes through, there are a lot of what we call stress hormones secreted from the baby that will also help the baby to sort of adjust to the environment outside. So what we do in a cesarean section is we make a cut on the tummy and then we deliver the baby before this normal path occurs. So therefore, actually speaking, in a way, if you really look at it, baby is stunned because you come out and you don't expect to be here, because all of a sudden you're outside. So babies might have problems with breathing, but these are kind of transient and it'll settle down. And with the current medical fields developments, you never have problems where babies die of having problems after cesarean section. So this is one way, like looking from the baby's side. So that's why I say vaginal delivery is much better if you don't have any other complications. So on the other hand, if you look at from the mother's perspective, now baby's head is about, we would say about 10 centimeters in width. So for you to do a cesarean section, you need to at least make a cut of at least 10 centimeters or a little bit more than that. So the mother's tummy, if you take, there are several layers and we need to cut all these layers one by one to get into the womb and to deliver the baby. And what we do is we then repair each one of these layers to we basically get it together. So in medically or in surgical, when we look at all these things, whatever the suture material or how meticulous we are suturing, you never get the 100% strength where you had before after surgery.
Right.
Even after 3-6 months, you will get about 70-80% of the strength from the previous amount. So having a scar can cause problems later on. And the other thing, like when you enter the abdominal cavity, it's not a place where you're supposed to freely go in and come out. So it gets exposed to the outside. So that causes what we call scarring within and can cause adhesions. That is where the bowel or the urinary bladder or internal organs, any of these things can get and stuck onto the mother's tummy.
So if you're
Or the
going in
scar.
for an subsequent surgery, it might cause
Yeah.
complications.
And then also later on in life, you might get problems with pain, unexplained pelvic pain, things like that can come up.
And with the weakness in the wall, they might experience hernias as well.
Yes, there can be. So if you take, on the other hand, normal delivery, so the birth canal is set up in such a way where you are allowed to send a 10 centimeter size baby set out of the body without a problem. So you don't need to make any additional sort of maneuvers or cuts or any other things. So that way, so for mother also, in a way, vaginal delivery is much better. And cesarean section, you don't have pain prior, but you'll have pain after the delivery, when you are with the baby, where you have to look after the baby. But vaginal delivery, you will have a little bit of pain before, or a severe pain, we'll say, but after the delivery, you'll be fine, completely normal, where you'll be able to nurse the baby very well. And for the pain also, for a normal delivery, there are now a lot of sort of advances how we provide pain relief. There's a way that we can provide pain relief like for a cesarean section. So for a cesarean section, why you don't get pain during that time is we give strong pain relief during the time of the C-section. So likewise, during the time of the labor, there are ways that we can provide strong pain relief where the mother don't feel anything at all during the labor.
Right. So considering all these pros and cons, of course, each one has its own pros and its downfalls as well. So the mode of delivery that would be decided for you would be very individual depending on your possible complications, which will be decided by your obstetrician in conversation with you. So that can't be generic to each and everyone. So moving on with our conversations, and now a lady becomes pregnant, we go through the dating scan, and then we come on to the second trimester. And when do they first start feeling the kicks?
So generally for a first time pregnant mother, it will be roughly around 20 weeks,
20 weeks.
or little later than that. But for a mother who has previously had a baby, they might feel the kicks earlier.
Right.
So somewhere around 19, 18 weeks, they might feel even.
And in pregnancy, we know scanning is one of the mainstay of screening that needs to be done, and there are a series of scans that they need to undergo. So we spoke about the dating scan, which was very important. So subsequent to that, what are the important scans and how often should they get these scans done?
So basically, from an obstetrician point of view, dating scan is very important. And the next scan that we go for is what we call the anomaly scan, which we do around 20 weeks of gestation. So that is 5 months. So in this anomaly scan, we can, from top to bottom, or like from head to toe, we can look for any gross problems that we can identify in the baby. So if we find any problems that are there, we may be able to do certain interventions to help the baby have maybe a smooth transition from the womb to the outside. So that is one of the most important. And a lot of mothers, actually what they want to know is the gender.
Yes.
So that is also easily done, can be easily done during this 20 week scan.
Right.
So other than for that, generally we do not recommend generically for everyone to have scans. So depending on your risk factors, or depending on how the baby grows, then we do further scans that can be somewhere around 28, that is 7 months, 8 months and 9 months. But these are depending on the situation rather than not for everyone.
Not for everyone.
Yeah.
And talking about the clinic visits or visiting the obstetrician, how often should they do that?
So this is also, it depends on the risk factors of the woman. But if you generally take somebody who doesn't have any risk factors, for a mother who's having the first baby, so we generally see them about monthly till about 28 weeks. So that is, if you say 12 weeks you see the woman, then you see 16 weeks, 20 weeks, 24 and 28. And from there onwards, every 2 weekly, maybe 30, 32 likewise. But from around 36 weeks, you recommend to see them every week. For a mother with a second pregnancy or a mother who has had a baby before, we don't need to see them that often. So we see them about twice weekly throughout from about 28 weeks. Now, having said this, now this does not mean that all of these visits has to be done by an obstetrician.
Okay.
So as I said, it's very important the booking, the anomaly, and then depending on this to plan on how the rest of the pregnancy goes on. Suppose if it is somebody who doesn't have any risk factors and everything is going perfectly fine, then you don't need to go and see an obstetrician all these visits. It's just enough to go to the MOH or even the midwife to do the follow-up during these visits.
So if they are uncomplicated and if they go to a medical officer or a midwife, what are the things that these professionals are supposed to screen, just so that our viewers have an understanding to always engage in a conversation with these professionals?
So generally what they do is they look for any of the problems that you are having at the moment. So likewise any discomforts or any symptoms or any alarm signs, anything that you are having at the moment. So they will look for it and try to identify and how it will affect on the pregnancy. So that is one thing. And then the second thing, they make this visits, make this each and every visit a screening opportunity. So that means they will look for your blood pressure, and then they will check the urine, looking for any infections or any proteins in urine, or that means like changes from the kidney level. So those kind of things they will be doing. That is for the mother's well-being. Other than for that, they also look for the baby's well-being, screening for the baby's growth. How generally this is done by using a tape where you measure the mother's tummy and correlate it with the pregnancy number of weeks to see whether the baby is growing at a certain way that we want the baby to be. And also each and every visit they will also listen to the baby to see how the baby's heart beats. So three things. So one thing, they will look for any of the problems that the mother is having. Then the second thing, they will make it a screening opportunity to look for any complication that the mother can have, and also screening for any problems that the baby can have.
So now, as we progress along the pregnancies, especially in the Sri Lankan context, especially with our mothers and the grandmothers, so they have this view that when you're pregnant, you have to eat for two people, and they try to load the mother to be with some food, and that's how they show their love. But I believe this is not really medically indicated, and it might give rise to certain complications as well.
Yeah,
so what's your opinion?
This might complicate things a lot, because now what happens is, now if you are starting at a very low weight, it really doesn't matter whether you eat a lot or not. But suppose you are starting at a very high weight. Now we are talking about this BMI to look for, that is the body mass index, where you calculate from the height and the weight, what is the actual value that you need to have. So generally about 30 kilograms per square meter we call it. We categorize them in the obese category. So if somebody starts at the obese category at the start of the pregnancy, and you eat for two, and at the end of the day you will end up around with a BMI of about 40 by the end of the pregnancy. If the weight increases more than what we want, and if you are very, I mean, like if there's a lot of fat in the body, then all this general screening get jeopardized. So basically, to look for the baby's size, we can't use the measurements, because we'll be just measuring the mother's fat. So we need to rely on scans. And at the end of the day also, when it comes to the delivery, either way delivering is going to be a difficult task, because doing a C-section carries a major health hazard for the mother, because they can end up with lot of complications, and also especially having blood clots that can shoot up to the brain and the lungs. So those are major issues associated with obesity. So that's why I say we don't have a specific cutoff. We don't want somebody starting weight and to increase 10 or 12 kilos by the end of the pregnancy. It's not the way it is. Baby, we consider the baby like a parasite. How much you eat, how much you don't, baby will start taking whatever the nutrition that the baby need. So that's how I generally advise them. So if you are starting from a higher weight, you don't need to eat too much. Yes.
And also it may have difficulties in losing weight postpartum as well if they gain too much weight during the pregnancy.
And Dilshan, just one thing.
Yes,
now you ask me what are the things that will be done normally by looking by the doctors who are looking for. So the other thing is now, other than for the screening and things, they also give supplementation for the mothers and vaccination depending on what they need. So supplementation is generally we advise mothers to take folic acid, calcium and iron throughout the pregnancy, starting from around 12 weeks, the iron and calcium and folic acid throughout. And then they will be screening for their red blood cells, number of red blood cells, or we call it the hemoglobin. And depending on that, we might increase the iron intake. That is one thing. Then the other thing is the vaccination that I wanted to talk about. During the pregnancy, we give tetanus vaccination. For a first pregnancy, we might give 2 doses, but for the rest of the pregnancies, we will only give 1 dose. So those are the other things that are done during this MOH visits or the routine visits.
Right. So as we progress along the pregnancy, when the mother to be is getting ready for the delivery, how important is it to pre-plan this entire process, and what's your opinion on that, and what is your advice?
So it's very hard to pre-plan what happens during pregnancy, especially for the first time pregnant mother. But it's important that you have some sort of an idea what are the things that you want and what are the things that you would not want, so that you can be very clear with your doctor to let them know this is what I would personally feel better for me. But you can't be concrete on things as to this is what exactly I want, because depending on the situation, things are going to change. Now, when I was working in UK, there were some mothers who were coming and saying, no, whatever happens, we want a normal delivery. So that is not possible during a pregnancy. When there are problems, if the baby is not doing fine within the womb, then we might need to resort to a cesarean section, although given that there are certain complications associated with it. But what happens is, at that point, you measure the risks and the benefits, and you make a decision depending on that situation. So, so what are the things that the woman should get prepared? So they need to have a sort of by about 32, 34 weeks, the baby might come at any time, I would say. So they need to have a plan for the delivery, in the sense you need to have a set pack where you pack baby's things, your things, and also you need to carry your notes with you, the antenatal records, where if there's an emergency, they can just go through the note and decide what next to be done. So those are the 3 important things that you need to be prepared with by about 32, 34 weeks.
It's always important to be prepared. Like Dr. Indunil said, you never know when the baby might come. So being prepared will always give you that instantaneous opportunity to rush to the hospital that you had planned. And even if you can't reach that destination, you definitely should reach the nearest hospital with all these necessary things along with you. Now, talking about delivery, imminent delivery, what would be the signs that you need to look out for labor? And there are certain signs that are mistaken for labor as well. So if you can elaborate on that.
Yeah. So basically, how the labor or the delivery occurs is, the womb will try to push the baby out of the birth canal. So what happens is, the womb contracts from the top, and then the baby is pushed or squeezed through the birth canal outwards. So when this happens, the woman will experience certain type of a pain. The pain will start from the back and it is going to go around the body towards the lower part. So we call it from loin to groin area, and it is going to come up like it'll start and then increase and then goes off. So it's like what we in medical terms we call it a colic. So it comes up and goes down, and likewise it comes back again and again, just
so it
not
comes
once.
in waves.
It comes in waves. And what happens is the body, now if you take a baby who's a newborn or a child, they can't just walk. They might crawl, or they might they need support initially. Likewise, the womb also is unable to make the labor pains all of a sudden. So what it does is it practices little by little. We call this Braxton Hicks contractions. So where suddenly a pain comes and then it stops. But now what happens is people get really confused whether we should go to hospital by this time or we should wait a bit longer. How you identify this is this Braxton Hicks contractions, they will come and go, but they don't come regularly and they don't increase over time. Labor pain, what happens is it comes, the next pain will come in 10 minutes and it's much stronger, and the next will come in about 8 minutes. So in no time you will be getting about 2 contractions within about 10 minutes. So likewise the contractions come closer to each other and they become much stronger and stronger over time. So that is how you identify between these two conditions.
So if you are a mother to be and if you are experiencing these contractions which are increasing in intensity and reducing in the interval between the contractions, most probably you would be in labor, and most importantly you should go to the pre-planned hospital that you had in mind for the delivery. And now with our time constraints, of course, and we spoke about the modes of delivery, the cesarean and the normal delivery, so both of which carries certain amount of benefits and certain amount of risks. But now after a mother delivers, again a very important period, especially for first time mothers, what should they be mindful about?
Okay, so after delivery it's a very critical period, because in a way now it comes to a situation where you have to, other than for your health, you have to look after somebody else who is completely dependent on you. Dependent on one thing for nutrition and also for protection and for daily other needs. So therefore it's a sort of a big responsibility that the mothers get by the time of the delivery. And on the other hand, there are certain other things that happen during the delivery where your hormone levels suddenly goes very low. That can cause a lot of anxiety or even mental illnesses to come up during the immediate postpartum period. So it's very important to stay strong during this time. And also during this period there are a lot of other things that are happening in the body, so that is trying to come back to the normal level from the changes that have occurred during pregnancy. So there will be on and off contractions of the womb that will cause pain on and off. Then there will be a little bit of bleeding here and there, and that will continue maybe up to about a few weeks from the delivery. And also there will be a lot of pains, joint pains, back pains and things like that. Even after a C-section or even after normal delivery, these things can occur. So what happens is there are a lot of things to get adjusted after delivery. So it's always important looking for help during this this time period, especially from the partner, or if you have any siblings or you have your parents. Try to get the maximum help from them during this initial bit, because it's very important. Otherwise it's very challenging at the postpartum period, especially like on top of this you'll be having sleepless because you can't sleep the way you want, because babies always get up within about every couple of hours for their feeds. So those are the challenges that you'll have after the delivery. Talking about how to nurse the baby. Now we generally recommend as health professionals for breastfeeding exclusively. That means you don't give any other things. You continue to give breast milk during the initial, at least about till 6 months of the baby. That is very challenging for the mother, but that will be very beneficial for the baby on the long run.
Definitely, family support from your extended family is very, very important during pregnancy and the immediate postpartum period, because it's a very challenging period in any woman's life. So we discussed pregnancy from the preconceptual stage to planning the pregnancy and getting pregnant, how to confirm it, and the sequence of events that you would go through. And with our time constraints, we have to wind up for this episode of Healthline. But before we go, sir, what would be your final take-home message to our mothers-to-be and mothers who are already pregnant who's watching? What would be your take-home message?
Okay. So basically, if you are planning to get pregnant, it's very important that you try to stay healthy beforehand, and maybe to seek for any sort of medical help if you have any doubts that you are carrying any sort of illness or any disease that might affect the pregnancy. Then once you are pregnant, it's really important that you get your scans arranged, you do the booking scan and plan, let the obstetrician plan what the pregnancy is going to be. So basically it's a enjoyable period of time. So you let the stressors to go off for the health professionals, and you try to enjoy this period of time, which is very, like, only you get only a few times during your life, isn't it? Then in Sri Lanka, which we missed, once you are pregnant, it's very important you get registered at the local MOH, so that you get into the census and the other thing. Then let the pregnancy go, and then if you are planning for a delivery, if you are planning for a normal delivery, you need to always be mentally and physically fit and continue your healthy lifestyle and exercises throughout the pregnancy, and then you'll be able to have a generally a uncomplicated pregnancy. Yeah.
So that is the hope, and that is why we want to bring these sort of programs to you, so that you can understand better what happens in these pregnancies, what sort of precautions you need to take, and when you should go and see your obstetrician, and all those information we bring to you, hoping that you will have an uncomplicated pregnancy and deliver a precious new life to this world without any problems. So having said that, it is time for me to take your leave. Thank you very much, sir, for joining us today and sharing this very valuable information with all our viewers.
Thank you very much for the opportunity that you have given.
It was a pleasure to have you, sir. So with that, we take your leave from this episode of Healthline. Until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Ayubowan.